In this episode of the OIS podcast, we hear the untold story about Dick Lindstrom's unlikely path to becoming the world's most renowned ophthalmologist. Let's listen in.
Good afternoon, everybody. This is Dr. Hassan Sadri. I am a board-certified ophthalmologist here in Newport Beach, California, Orange County, and I'm also a partner at Visionary Ventures, also located in Orange County. And my next guest is, I'm actually so delighted and just unbelievably excited to get him out of his busy schedule, come join us. He's an international recognized leader in our field. Some say he's probably the most famous ophthalmologist that ever lived, and I believe that. And his extensive career spans on cornea, cataract, refractive surgeries, and he's just I've been really fortunate enough to be friends with him, and I consider him a mentor and a partner on different ventures that we're involved with. And his name is Dr. Richard Lindstrom, Dr. Dick Lindstrom. We're absolutely delighted to have you. How are you doing, Dick?
I'm doing well. So the good news is I'm hunkered down in Minnesota and staying well. So, and the whole family as well. There are 20 of us here. So far good.
Yeah, I remember I got you on the phone. I think you were the first person I called when we got shelter in place. And I, we both said, hey, we'll probably be back on the air in June, and here we are in July. It's kind of bummed that I missed you. I haven't seen you. So how you been? And how's the family? And what are you guys doing to keep going?
Well, we're all well here, and our practice, Minnesota Eye Consultants, is back actually to full speed ahead. So we. Like everyone else, we're down, about 80%. We never closed, but in April we were just doing urgencies and emergencies, and we were down about 80% in April. Came back to about 50% to 60% in May. And June we have, towards the end here and on into July, gotten back to really 100%. We've learned how to see patients just as fast as we did before in the clinic and also in the operating room. But our overhead has gone up. And what I say is that we have more screeners and cleaners, So to get into the office, you need to be screened. And we've had to hire people to screen the patients and then to, operate and or see patients in the clinic at a full bore pace and to do the right thing as far as hygiene. We've actually have cleaners that just clean the lanes after every patient. So, and then of course we have the personal protective equipment for the patients and for us. So we can take care of patients. I would say it's in some ways not as much fun as it once was because the patients have a mask on, we have a mask on. You don't quite get the facial expressions and the interpersonal relationship. We can't have as many family members in the waiting room. As a matter of fact, we only have a family member if the patient absolutely needs one. And so we don't get to interact with the family like we once did. And we always wore masks in the OR, but only during the case and then took them off. And now, from 7 in the morning till 6 at night, if you're working a long day, you're wearing a mask. And, for me, that's annoying, but I think it probably is for everyone. But we've adapted. The number of patients who want us to help them preserve, restore, and enhance their vision is as many as ever, and the value of vision is still high. And so our patients are coming in. We have a few that are anxious, but they're less anxious when we see the safe way we manage them, and they're much less anxious coming to outpatient clinic for ophthalmology exam or to an ASC for ophthalmology surgery than they would be, for example, going to a hospital outpatient department. So we're back busy, and some of my friends actually are even performing a little higher than they were prior to COVID as they catch up. So we went down more than anybody in ophthalmology, and I think we've come back faster than anyone in ophthalmology. and we're an example of that here in Minneapolis.
So I'm really excited because, as you can see, if you're listening to this, you see how open and transparent he is, and also probably very thorough. It's one of the few people that I've met that um, has the ability. You have the ability, Dick, and I tell you this in front of you and behind you, that you have the breadth, but also the depth of knowledge when it comes to all the different things that you and I talk about, and especially this COVID business, because it's your long, very uh, lustrous career. I think this is probably the first time, right? If you ever seen something like this, and yeah, let's pivot a little bit because I want to get your opinion. You got like more than 40 patents, right? Mostly on corneal work that you've done, IOLs and instruments, of course. What are your thoughts on, and you and I talk about in these calls on the visionary side, on the smaller companies that are really sort of, they don't have the resources, they're startup, they don't have a lot of dry powder. What's the good word for them? What should they be focused on?
Well, I think we are small businessmen as ophthalmologists, and uh, and then I do serve on a large number of board of directors from my work with the investment firms Flying L and Visionary Ventures with you, and then also some other startups on my own. And I think the challenges are somewhat similar. We initially needed to look very carefully at both the cost side of what we were doing and cut costs where we could, and at the same time sort of raise some capital, as a method to preserve our futures. And so those were the two things that most of us did to try to survive, the worst of this. And the smaller companies obviously are coming back as well. So we have two sets of small companies we deal with. One set is the pre-commercial company, and most of them are basically in the clinical trial stage. And of course, clinical trials, went to a minimum. And so that basically set them behind. And each startup company has a certain amount of overhead to keep the lights open and the team in place. And if you're not enrolling patients, that's a meaningful drain on funds. And so that's been a challenge for the pre-commercial company, and basically move timelines back. And so that means that we won't get quite as far as we'd like with any startup company that's in pre-commercial stage before we might have to raise more money, and that will be a challenge. And I guess we'll have to see what money raising looks like in the next 6, 12, and 18 months. I have some anxiety about it, but so far, capital has continued to be available. In the early commercial companies, obviously they got crushed if they were providing supplies, to the ophthalmic field, and whether they're big or small, that was difficult. And many of the smaller companies are less well capitalized, so it was the same issue, which was to rapidly reduce costs, which usually included furloughing, employees, and looking to take advantage of the government programs, when appropriate and when available, and then trying to set aside a war chest, if you would, of capital to try to survive. I would say that we're all a little anxious right now. I mean, in America, we kind of blasted up to about 32,000 cases a day from about 100 cases a day between March and April, and that's when we shut down. And then we all behaved and social distanced and wore our masks and washed our hands and the like, and we went, for the next 2 months from 32,000 to 25,000 to 21,000 cases a day. And then we started loosening up, and I called it a little bit like cabin fever in Minnesota. I called it COVID fever, but everybody sort of went rushing outside and headed for the bars and headed for the beaches and headed for the restaurants, and forgot to you know, deal with their social distancing and masks and the like. And we're having a meaningful surge in the cases around America. Some states worse than others, but even in the better states, there's somewhat of a surge. And we've gone from that 21,000 cases a day up to over 60,000 cases a day in about a month's time. And we don't know how high it will go, but it's still going up. Some people think it's the second wave, but it's not the second wave. We're still in the first episode here. We may still have a second wave to look forward to, 6 to 12 months from now. But we haven't managed the first wave yet.
Yeah.
So now those states that are, struggling are having to shut down. I think the real question for we ophthalmologists is, will we get shut down again? And I personally believe that, those of us that operate in our own clinics and in our own ambulatory surgery centers will not get shut down. But I do believe there'll be some doctors who work in hospital outpatient departments, perhaps some doctors in university medical centers or large clinics where, there is a big surge of COVID cases coming in, where there might be another, you know, dialing back, if you will, of access to elective eye care and elective surgery. But so I think we private practice ophthalmologists have seen the worst of it, but I'm anxious for some of our colleagues who work in the bigger medical centers because they're getting overrun in some cities again, in Texas and in Florida and in Arizona. And there's a little anxiety in some cities, even in California, where you live.
Yeah, it's been certainly challenging. And I definitely think the issue here locally, as you know, Orange County has been sort of a renegade when it comes to wearing masks. And locally, what they did was the Orange County Board of Supervisors yesterday voted to open the schools up, no mask, no social distancing. So go figure. Whereas LA and San Diego are closed, I have a feeling that that's going to change. But to your point, there's this sort of laissez-faire sort of attitude towards the COVID crisis. And I do think that people got cabin fever. We do think that there's going to be some shutdowns, and that's going to impact a lot of things. You predicted correctly when I talked to you in March that we would be back 100% in July. You nailed it, and we are. Although I don't know all practices if they're doing that and how that's going to be if there is a second wave and shutdown. But let me pivot a little bit more and talk to you and our audience really about your career, because you've had such a long and persistent, impressive career in so many different things. Like you said, you're a board member of 20 companies. And a lot of people ask me to ask you, how does he make it all happen? Like, how do you, how do you have like more than 24 hours in a day, Dick? Like, there's something that we don't know. What's your secret? What's your secret?
Well, maybe I'll spend a minute, telling a little bit of my story and some of the things that people don't know, probably, and then there might be some positive examples for other people, interested in a similar pathway. But I'm a fourth generation Minnesota Swede. I grew up in a blue collar family. My father owned a construction business, and when I was just in junior high and high school, my dad already had the Lindstrom and Son sign in the closet, and I started following him to work when I was 12, and so I did get an insight into managing business and got an interest in business from an early stage because I was sort of born and bred and groomed to take over the family construction business. And so I went off to college to get trained to do that, and I had a great growing up life. I lived on the shore of a lake here in Minnesota, and played football, hockey, baseball in high school, and was active in social events and captain of my hockey team. And so I had a great upbringing. Went off to University of Minnesota, and joined a fraternity there and lived in the fraternity Sigma Alpha Epsilon, and had the opportunity to exercise some leadership there. I spent 1 year as Russ chairman, one as vice president, and one as president of the fraternity, and so I got to learn what Robert's Rules of Order were, and again learn a little bit about leadership. And then and the only way to learn how to lead is to be given opportunities to lead and then follow through. So what I say a lot of times to people is that if these opportunities present, say yes to opportunity is one thing. And that's a little bit of what happened to me as far as medical school. So I was, a good student. I ended up in the honors division at the College of Liberal Arts at the university, and randomly, I got the dean of the medical school as my advisor. And the dean only took 2 students a year, and he ended up with my name. I wasn't even in pre-med at the time. I was planning to go into the family business. Very charismatic dean. And when people ask me, did you always want to go into medicine? No, I was going to go into the family business. But this dean talked me into going to medical school after about a year. He was very charismatic, and so basically medicine picked me. So I went off to medicine, and same thing happened there to me in regards to ophthalmology. In those days at the University of Minnesota, you could pick a medical track, a surgical track, or a pediatrics track, and I picked the surgical track. And like many people, I thought maybe I wanted to be a orthopedic surgeon, or maybe a cardiovascular surgeon. And in my second year of medical school, a new professor came from Harvard, Don Doofman, who is a cornea specialist and was working on corneal preservation. He went to that same dean that talked me into going to medical school and said, hey, I need a medical student to work in my laboratory. And the same dean said, well, why don't you go talk to this medical student, Dick LINDSTROM, and he did. And so in my second year of med school, I needed some money for spending money, so I went to work in Don Doofman's laboratory, and that began a collaboration that really extended until till his death. And so that sort of tracked me into ophthalmology. After you spend, he had my whole career planned out, right? I was going to become a cornea specialist, come back to Minnesota, join him, yada, yada, yada. And that's kind of what I did. So, but again, it was, I could have said, no, I don't want to do that. I want to be an orthopedic surgeon or whatever. And again, it was this concept of saying yes to opportunity when it presents. And so I said, sure, and joined his lab and ended up as an ophthalmologist. The chairman of the department was getting older, getting ready to retire. In those days, our chairman did cornea cataract and some glaucoma surgery. Refractive was really not being done at the time, other than corneal relaxing incisions and keratoplasties. And so we put together a fellowship training program that would train me in all those skills. So I did a year of a cornea fellowship at Minnesota. Then I went down to Dallas, Texas, and worked with some very high volume cataract surgeons in Dallas, Texas, Bill Harris and Charlie Key, and learned about phacoemulsification. And in the early days, got introduced to posterior chamber lenses, actually in the late 70s. And then I went off to the University of Utah and did a 6-month fellowship in glaucoma. So I ended up doing fellowship training in cornea, cataract, glaucoma, and then went back on the faculty at the University of Minnesota as an assistant professor. And they also made me the chief of ophthalmology at our VA hospital, which was at that time the busiest surgical VA in the US. And so a lot of eye surgery was being done there at the time, and that's where our senior residents went to learn their surgery. So I ran the cornea service and saw lots of patients, did lots of surgery, had my own research lab, continued to do research into corneal preservation, and spent a decade there and went from assistant professor all the way through full professor. And when I decided to go into private practice, actually also had an endowed chair. I was pretty happy at the university, but the university, ran into some challenges as far as accessing patients, and that's what led me into private practice. Now, how did I get involved in industry? So I was a young assistant professor, 31 years old, and I got a call from one of the senior VPs at 3M, who then became, over time, a good friend, Bill Coyne. And he said, well, I'd like to come over and talk to you. I said, sure, I'm happy to talk to you. 3M been very supportive of the University of Minnesota. And so he came over and he said, well, we just bought a company in the ophthalmology field, and we'd like you to be our chief medical officer. And I went, are you sure? And he went, yeah, we've done our due diligence, I'm sure. And I said, well, I don't even know if I can do that. And he said, well, we know you can do it, so go talk to your department chair. And the ruling at that time was, when you're at the University of Minnesota, or in most universities, you could kind of have one day to do what you wanted to do. And so the dean and my department chair said, yep, you can do what you want one day a week. So I spent 15 years, going over to the 3M campus. I had an office there every Friday. And that, of course, was an outstanding, business education on top of what I got in my schooling, but also from my own family. And that got me started really working with industry. And I would say at some level, again, it's saying yes to opportunities. So, I mean, I was kind of out of the box. I could have said, no, I'd rather just spend that day seeing patients or working in my own research lab. I didn't know what it would be like to work with industry, but I found it was, very satisfying and very constructive. They were a very research-oriented company. I got to work with a ton of PhDs, two veterinary ophthalmologists, did a lot of research on new technologies in the eye care field. And they later, both contact lenses and devices, not drugs, and they later divested actually their technology to Alcon, and actually that's where diffractive multifocals came from. The first gas polymer, gas permeable contact lenses came out of the 3M labs and the like. And so that got me started. And, I just kept basically, taking a certain amount of my time and committing it to, working with industry to resolve unmet needs. And when I was 31 years old, I found it rewarding. And when I'm now today 72 years old, I still found it rewarding. So I went off, and had a very busy clinical surgical practice at the university. And I then started a private practice, Minnesota Eye Consultants. And I wanted to have an academic private practice, and realized this was, over 30 years ago, and there really weren't academic private practices. So I went around town and tried to find, there were quality practices, but none of them wanted me to do, research or clinical trials and the like. They just wanted me to come in and see as many patients as possible and turn the crank, if you will. And I said, well, no, I want to do at least one day, maybe 2 days a week of academic work, and I'll see patients the other 3 days. And everyone said no. So that meant the only way I could, build an academic private practice was to create my own. So I went into solo practice, me and 6 employees. And that was the beginning of Minnesota Eye Consultants, which is now 55 doctors and 400 employees. And we've continued to be an academic private practice, 31 years later. Do a lot of clinical trials, and I've got very prominent partners, as you know, that I've sort of followed in my footsteps. When I was a university doc, I started training fellows. It was interesting. One day I was a fellow, and the next day I was training fellows. And so for my entire career, I've been training fellows. And when people, ask me what's the most rewarding thing in your career, it actually is working with the young fellows. And while I was at the University of Minnesota, the residents, but today it's mostly fellows. And I have done some inventing, as you've said. I actually coming up on 50 patents now, and I've licensed some of them, and they're out there in the world being utilized. And I've worked with companies large and small. I still consult with big strategics, but I mainly work with startups nowadays. But and still have a few of my own ideas and inventions, and I find all of the above rewarding. Uh, as far as nobody can follow someone else's pathway, but I do get asked a lot. Well, I would like to do some of the things that you've done. I would like to get engaged with industry. And what I say to people is that the first thing I believe you need to do is you need to get into practice. Get yourself well trained, but then get into practice and build a large practice in an area of interest. And it has to be an area you're really passionate about and interested in. And once you build a presence, and it does take a few years to do that, but once you build a presence in really any field, then you can look around and see, so which companies are interested in this field. And there's lots of ways to get connected once you built that presence. And then probably the easiest way to start to work with industry is to do what we call investigator-initiated clinical trials. And so let's say you have, you have an interest in glaucoma, which would fit you, Asan, and many. Then you have an interest in glaucoma. You got to build a nice glaucoma practice first, and have some skills and knowledge. But then you go to a company that wants to, that's trying to develop something new and interesting in glaucoma, and then you offer to do a clinical trial on their current technology. And then once you do a nice job, for them in that regard, and then usually you get invited to talk about your outcomes, so you get a chance to get on the podium. Then you're likely to be invited to participate in their clinical trials as they're developing the next gen technologies. And so it just sort of builds, one step at a time. And everyone's in a hurry. I was when I was young too, but you kind of do have to do it one step at a time. First, you have to have the critical mass of patients. Then you have to have the area of interest. Then you basically have to have a few ideas, and then be willing to do the work to study those ideas, and then share your outcomes with your colleagues. And if you get invited to speak, you have to give a good talk. It's all the usual things. You're being tested and evaluated along the way, but uh, that's the way you kind of block and tackle your way up. And then what ends up happening is companies large and small end up coming to you, when you reach a certain level. So,
Yeah.
uh, but it's a commitment, and in the world, I would say in the world today, economically, uh, probably it's as lucrative to efficiently see patients and do surgery as it is to work with industry. And so, I mean, it really does at some level have to be a passion. Uh, it is possible when you start to work with startups, and you're serving on their medical advisory board or board of directors, that you don't get paid much, but you do get the opportunity often to get some equity. And if those companies become successful, economically there can be an upside there. But just going and consulting for a major strategic, to be honest, I have several young docs that have said, that's an awful lot of work what you do, and actually if I just stayed home and saw patients, I'd be economically farther ahead. And they're right when you analyze it that way. 20 years ago was a different world. I mean, the industry could pay a little better than they can pay today, but it's all the rules and regulations today. They really can't, pay an ophthalmologist arguably as well as an ophthalmologist can do just staying home and seeing patients.
Yeah, no, these are. I mean, you're spot on, and I think for our audience, you cover such a good ground of your perspective. But to your last point, you're absolutely right. When you're first starting, and you fly out to, although now with COVID, you're not really flying, but you fly out to wherever, and then you miss a day of clinic, and you come back. Um, it might sound glorious, but you're right. Economically, it's actually probably worse than a wash. But
Yeah, the rules and regs are so stiff nowadays. So, I mean, now you fly, let's say you're going to fly off to, visit a company in another state. They can't, they can provide you a coach airfare, but they can't, pay you for your travel time. So you give up that travel time for free. And then, if you spend a day with them, they can pay you for 4 hours. And, typically, reimbursement rates, because they're the same everywhere, depending
yeah,
on your experience, are, maybe $500 to $700 an hour. If you thought about that, you would go, that's not too good, to get paid, and then you got to fly back home. So, you spend a day and a half for $2,000-3,000. That's you can do better than that in the clinic and OR. So
yeah, and you know what? To your point earlier, though, if it's in your blood and it's in your passion,
yeah, you
then
have to be passionate about it, and some people are, and it is fun to work with the major strategics on exciting new technologies. There are a lot of super bright people there. They are very committed to helping others, just like we are, and there are definitely a lot of unmet needs, and so we need those clinician scientists who are willing to help, translate the bench research to the bedside, if you will. Um, and fortunately, we have quite a few of them that are passionate about it. And then, of course, we need people to teach. Once we have a new technology, who better to teach somebody else how to use it than the people who were involved in the clinical trials and the development of the product. I mean, they know it
yeah,
in and out, and so So that's the way it is. Um, but every step of the way, it does have some challenges, and I've seen a lot of people, give it a try and then not really enjoy it and fall off on it. But some of us, and I guess you and I are in that list, we do sort of fall in love with it, and then we're passionate about it. We get excited about innovation, and that's what the Ophthalmology Innovation Summit and everything that you do, Craig Timack, is all about. Is sharing that excitement and solving that next problem and helping people.
Yeah, and in that order, when I look at your career, what's really, I tell you as a friend, you told me once you have these 5-year goals. You remember that?
Yep,
Um, I remember everything you told me. 5-year
have fun.
goals, personal, and you got your career goals. And then, so what's impressive, someone like me looking at you, peeling back the layers of the onion of your career, how you were able to manage up and down. What I mean by that is what's remarkable is you've trained over 70, 75 fellows, call it. A lot of these guys are the big names. Some of them have gone on to great startups, which you and I have funded. And then, but at the same time, you managed to be president of ISRS, ASCRS, and all the international stuff you've done. That's the remarkable thing that I'm so impressed upon, like how you do that part of it too. Tell us a little bit about that. How did you find time to run a big clinic and recruit doctors, and then do that as well and make sure Jackie's happy?
So I am a planner, so I do believe you need to be a planner to have a functional life, because otherwise you just get bounced around. And I do plan in 5-year increments, and it may sound a little bit funny, but we kind of get plugged into that a little bit. It's not exactly 5 years, but we go 4 years of high school and 4 years of college. Although many of us take 5 years. I did it 4, but nowadays 5 is not unusual. But medical school and internship is 5 years, and residency 2 years of fellowship for me was 5 years. So I'm basically on my 11th 5-year plan in ophthalmology, and I'm still doing it, and that plan, however, I do together with my wife, and it does include how much time do we want to take off, and what do we want to do, and where are we in our life as far as children and the like and their needs. And so you can plan ahead about 5 years, and some people try to go longer, but I find that pretty effective, because sometimes what I want to do and what I can do seems to change every 5 years. And so doing a 5-year plan, helps, and both personal and professional. And personal includes family. And for example, when I turned 55, I sat down with my wife and we said, while we're still healthy, let's take some time off. And when I turned 55, we went off to Hawaii and bought a second home in Hawaii. For 5 years was the plan, and I basically took 12 weeks off every winter. And a lot of people say that's impossible. You can't do that, but it's not impossible. You can do it. So I would work a month, and then I would go. And I had a group. That's the advantage of a group. But I
Yeah.
would work a month, and then I go to Hawaii for a month, and then I'd work another month and go to Hawaii for a month. So I spent 12 weeks in Hawaii every winter.
I
And
love
after 5 years, we liked it, so we did it again. And you just you couldn't do it if you didn't plan it out. And we did it during the 10 years that my children were away in college and getting their training, and they could come over and visit us. And so it worked out pretty well in that regard. And then they moved back to Minnesota, got married, started having their own children, and then Hawaii was too far away. So the next 5-year plan was to come back closer to home. And as you know, that's when I bought a second home there in the Orange County area, in the Irvine Newport Beach area. And that's also ophthalmology mecca. So it worked out great for my consulting, and that was only 3 hours away. And so instead of doing, the schedule I told you, I started to do 2 weeks 2 weeks in California, 2 weeks in Minnesota, 2 weeks in California, 2 weeks in Minnesota. And, some of these things that are maybe a little out of the box, you can do it. And in a sense, it was saying yes to opportunity again. And when my wife and I look back on those 10 years in Hawaii, we go, wow, those were great years. I mean, we were quite healthy. We'd play tennis in the morning and golf in the afternoon and watch the sunset and go out for dinner. And, those were very special years. Now I could have been seeing, I guess, another, 60 hours a week worth of patients, but, I've been adequately reimbursed, and you do have to have a financial plan and the like, and I found, that was worth doing and worth, I guess, the loss of income. So, I mean, not everybody wants to do that, but you can, once you figure out what it is you want to do, then you lay out the plan. And then sometimes you need advice and you need a mentor and the like. And as you said, if you say, I really want to find a pathway into industry, that you can talk to someone who's done it and have a 5-year plan of here's the things I'm going to do. And it's amazing when you lay out your plan that there are people there that, you'll find people that are willing to help you. And, we all do need some mentors along the way. And so it is important to find good ones, but they'll help you, uh, make the pathway that you want. Every now and then, make a 5-year plan, and it's not what didn't turn out to be what you liked, then you can, of course, stop at any moment and start over, right? So you don't have to complete a bad 5-year plan. I mean, that hasn't happened to me yet, but if you if you made one that wasn't working for either you or your family, or was disruptive to I'm going to go sail around the world and goodbye to your wife or something, and it wasn't, constructive to her, then, that plan might end up having to be aborted. But, but for me, so far, that I haven't had to abort a plan yet. So, but I mean, you have to be flexible. And, obviously my plan this year, for 2020, is not going according to schedule. But I have what I call a day timer, and I'm one of those strange people. If you ask me today, what are you going to be doing on August 10th, 2022, I can tell you. I can tell you where I plan to be. Now, if COVID-19 says I can't go, then that's a different story. Or if I'm sick, then that's a different story. But I mean, I actually plan, several years ahead, and know exactly where I intend to be at any given moment. And that includes planning to have time for myself and for my family. And my whole extended family here in Minnesota is 20 people. So I get everybody together, once a month. And then, to have a good friend, you have to have shared experiences. I think that's you got to have shared, perspective on life a little bit, but you also have to have shared experiences. And so you need to take the time to go have some of those shared experiences. And if you don't put them in the schedule, they don't happen. And you and I know that's true because, we'll plan ahead 2 or 3 months to have lunch, right? And, if we plan ahead 2 to 3 months, it works.
Yeah.
If we didn't make that plan, we wouldn't, right?
Yep. Yep. Agreed. So I know you have a billion things going on, but I want to, and that's just, it's just incredible to have your perspective and sort of have that drive, because I think a lot of people just sort of get out into community work, and then, they just kind of go into what I call automatic mode, or, autopilot mode. And that leads to a lot of burnout. In my generation, a lot of people are burning out because they just don't have in my opinion, the passion when it comes to, the grind, they call it. And these are their words, not mine. And I think that some of the things that you're describing really, for those of you listening to me, is remarkable because you're still getting stimulated. You're still doing, novel stuff, but you're also teaching. So you're giving back, and there's a lot of fulfillment that goes along with that. But also, if you're a study of psychology like I am, and what I like about your planning is you get a lot of certainty, because you have, like you said, August 22nd, 2023, you intend at least to be in Kauai with, Jackie, and hopefully I'm invited. And there's this certainty that goes on in your life that I think helps you. And I think it helps. I really do. And So on that, what are as your parting words for us? What are some of the things that you're excited about now, innovation wise? I know you and I talk a lot, but what's top three? What do you say? Like, these are the top three things in my mind that I think are really unmet needs, and these are being developed, and you're excited.
As far as new technologies go,
Yeah, anything. And then, in my opinion, also, what if they're not being developed, but you would say, it'd be really cool to have this. What are some things that you would give advice to both ophthalmologists, but also in industry?
well, I think the first, obviously, at top of mind right now is that we are going through a once in a lifetime, I hope, difficult time, and the first issue is to survive it, both personally, family wise, and in your practice. And so that obviously needs to be a little bit top of mind right now. So we are all adapting to something totally new, um, and I think that's necessary. I think we are still pretty breast in ophthalmology. Ophthalmology still supports innovation. There is a tremendous amount of innovation coming, and the most common thing we do probably is cataract surgery. And I've been asked more than once to say, well, tell me what it'll look like in 5 years or 10 years, and we're going to need to do twice as many cataracts as we do today in America, and in about 5 to 10 years, and with the same number or slightly less ophthalmologists. So one thing to keep in mind is you're going to be very busy, and two, you're going to need to be very efficient. And what I believe, we'll be doing, and I won't be doing it, you'll be doing it, but, we'll be doing bilateral same day sequential cataract surgery. That will be routine. We'll be, implanting, accommodating adjustable intraocular lenses. So everybody will end up plano sphere without having to have any corneal refractive surgery or other, treatments other than an adjustment to the IOL. And we'll have accommodative amplitudes that will be enough so that we'll have a full range of vision. And so we're going to be able to give people back the kind of vision they had, pre-presbyopic emetropic vision like I had when I was 40. And as that happens, the age for surgery is going to just keep drifting down. And we'll be, treating a lot more, in quotes, dysfunctional lens syndromes with very, very mild cataracts. And the definition of cataract might start to be presbyopia. So and that's going to even increase the volume of surgery even higher. And that is such a bread and butter part of what we do in ophthalmology. Cataract surgery is critical to most of us. And so I would, focus on being an efficient and quality cataract surgeon and being able to work in an efficient and quality environment. And if at all possible, be able to be an owner in that efficient and quality environment. And I tell all my fellows as they're looking for their next practice that, you want to be on the facility side because that side seems to be more robust to third-party reimbursement reductions, and if we get capitated, it's also robust there. So pay attention to that. I think for the anterior segment surgeon, corneal refractive surgery and glaucoma are critical, and I'm a believer in an anterior segment surgeon that should be able to do cataract, lens-based refractive, cornea-based refractive, and glaucoma. And the surgeon who can do that is going to prosper and do well, especially if they do it in their own facility and in their own ASC. And we're probably about to learn that in COVID again, where some of our friends in the hospitals are going to get shut down, whereas those of us in our own offices and ASCs are going to keep cruising right along. At least that's my belief. So we're much more robust to external environmental challenges when we work that way. There are other great specialties. I mean, retina is a great opportunity as well, but I'm an anterior segment surgeon, so that's where I spend most of my time thinking. So be a diverse, broad anterior segment surgeon, be a great cataract surgeon, be able to take care of lens-based and cornea-based refractive, and also be able to manage glaucoma, and you'll have a prosperous future.
Absolutely, absolutely. And I think that you and I can spend a couple hours. There's so much. You have,
Yeah, we could.
and I really enjoy you. But Jack is gonna get mad at me, and I'll never see you. So, having said that, I really want to thank you for spending your precious time with us, and I look forward to seeing you again in person when the COVID settles down a little bit here in Orange County, and hopefully in a meeting as well. That I was really bummed that the AAO canceled, went virtual, but I totally get it.
Me too. Yep. Well,
Um,
we look forward to seeing you.
yes, same here. Thank you so much again, Dick.
We hope you enjoyed this episode and plan on joining us for the Dry Eye Innovation Showcase on August 20th. Be sure to visit OIS.net and register today.